Welcome, guys, to the PelviBiz Podcast. I'm your host, Kelly Alhooie. Today, we are going to go over coaching versus therapy and what that actually looks like. And today, we have a special guest on today, Julia, the amazing COO of PelviBiz. Welcome, Julia.
Hey, Kelly. So happy to be a part of this. Okay, so I'm going to start out and kind of ask Kelly some of the questions and topics that we've been seeing regarding coaching, and she's going to help us get some feedback on it. So, Kelly, what's kind of the shift that you're seeing with providers now offering coaching services, and kind of what is that?
Yeah, great question. So let's just start first with the definition of what a coach is. A coach is not a licensed provider, meaning they don't have the same rules as a provider. They can practice in any state, they don't have to do notes, they can, you know, do different recommendations and get people the results, but they don't have to be under an actual license. So let me give you an example of this. This could be an actual student. This could be a health and fitness coach. This could be someone that literally just had a baby yesterday and become, a postpartum coach. It really doesn't have a label, and or it has a label, but it doesn't have something where you have to like go to school to get a degree. Let me say that a coach is someone that they feel that they have a solution to a problem and they feel that they can help you with that. That is what a coach is. Yeah.
Okay, so what would be the difference between really coaching and being a treater or a provider for treatment? So does the treatment itself change? How would that adjustment go?
Yeah. So when it comes to coaching, coaching is where you're going to verbally and visually walk someone through how to actually get a result. When it comes to therapy, how I truly define this is therapy is a lot of touching. Doesn't have to be, but that's how I'm defining this right now. Is therapy is manual therapy, right? And it's truly actually putting a diagnosis on someone and labeling them as that diagnosis and saying, well, this is what we're going to try to solve. When you're coaching, it's a more broader general. You may be hitting the diet aspect, you may be hitting the fitness aspect, you may be hitting, you may be hitting leakage, but you're not diagnosing them with stress, urinary incontinence. That's therapy. And therapy also could be reimbursable. Coaching is not reimbursable. I think that's also a very clear defining line as well.
So really coaching could help get the same or even better results because they're not restricted with insurances either. So let's talk a little bit more about the results. I think that's a lot of concern people have is potentially coaching is seen online as well, or because they're not getting diagnoses, they're not getting the same results somebody would look for or pay a provider to give them.
Yeah, so coaching can give the same results, if not better than even therapy. And I know that's a bold statement to make. And I'm saying this because I've done it and I've coached other people to do it and I have seen it. Whether or not it's through teletherapy, which would be under the umbrella of therapy, or whether or not it's through virtual coaching, that's under the umbrella of coaching. Uh, Either way, I have seen people online get the result for patients that they are looking for without even touching them. And it's all through, which most providers do not realize, it's all through using visuals on the screen that they're talking to the person. It's also all through the patient being able to demo back what you asked them to do. That is huge. And then the patient coming back and being reporter, the patient is more involved, whether or not it's teletherapy or therapy or coaching, anything online, the patient actually has to be more involved. And so what I have found with that is you're actually going to get better results because the patient has to be into it. If they're not into it, then you're not going to get the results. Comparatively, anything in person, because there is coaching in person and there is coaching in the therapy space, right? And anything in person, It is where the patient can be more passive. So if I do tons of manual therapy, well, are we specifically, guys, let's be honest, are we really specifically sometimes talking about the patient issue the entire time we're working on them? No, we're talking about their weekend, we're talking about their kids, we're talking about whatever. So sometimes we get distracted when people are just doing heavy manual therapy because we're focused on other things because we're just, working on them and going through our routine. So we have to be very mindful, I think, of how we're defining coaching, because there's coaching online, there's coaching in person, there's therapy online, there's therapy in person. So therapy online is teletherapy or telemedicine, right? So I think there's a lot of different labels. And I think being very clear moving forward of what people want and how we're going to administer the result, because all that matters is the result. And if we can get people the result, whether or not we save them time or not, that's up to them. And it's up to us to also get the messaging out there of we actually can get the same result, if not better, online and not touching comparatively if we were touching someone. And I honestly believe it's going to move into that. And if you aren't ready for it, which I believe most therapists are not ready for that to happen, then you're going to be like, well, why is no one coming to my practice? And I think that's going to be a big disconnect. So what we're trying to do is get you prepared to understand that people want you in their pocket when they want you, not at 9 o'clock on a Monday morning and they have to call the office and schedule. It's changing, and the price is also changing as well. So if we want to get into that, let me know.
Yeah. So let's talk a little bit more about the actual shift, what we've been seeing patients want, and really the pricing of it. I know there's a lot of therapists out there who are struggling to keep their price point for these one-on-one sessions because they're just seeing people aren't paying for it. So, with all those shifts, how are we going to best integrate that shift so that you
Yeah.
stay ahead of the game and don't get left behind?
Yeah. I think the number one thing that I have come up with is I think this is riveting information. So I hope anyone that's listening to this, please like us, 5-star review us, because I really believe this is going to be the thing that is going to shift. Group coaching. If you are not doing group coaching, I believe you're going to be left behind in time and money. Because what is happening right now, which PT school, OT school, medical school, whatever, is not telling us. We are capped out at 8 hours a day of what patients we can see. You cannot make more money and you cannot get any of your time back because you have to physically be in front of someone. Whether or not that is online, guys, or in person, I'm talking to both of you guys. Even if you sell virtual therapy, telemedicine, you are still trading your time, a service, to then get money. I'm trying to get us to think outside the box and actually come up with a real solution that no one else has come up with to actually get our time back and still deliver the most amazing results to our people. And I believe the solution to that is group coaching. Group coaching is where you can coach one to many. And I just didn't like come up with this. This took me months to figure this out. And the reason how I came up with it is just a quick backstory here is when I sold my brick and mortar practice and I had time to think of what Julia and I were doing for PelviBiz, I'm like, but wait, why can't we do this and make this equivalent to therapy land or make this equivalent to medical land? And I'm like, it doesn't have to be one-on-one because we know there's patterns and most people have the same exact pattern, even though they believe that they're unique and different and whatever. And that doesn't mean I can't customize it in a group setting. I can still customize it in a group setting. But the same thing, you guys do the same treatment. This is what I don't think you understand. You do the same treatment no matter what in the freaking eval got diagnosed. You do the same thing. So why don't you systematize it? This is what PelviBiz is amazing at. We systematize everything. And so it's like, systematize it. So for 1 hour, maybe even let's just go for the lowest example. You see 2 clients in that 1 hour. Now, I'm not talking about like an insurance-based company where it's like you see one person for 30 minutes and then you see another and they're back to back and all. No, you see them together as a group and we're just solving leakage with Jumping, that's the solution. We're solving that. One problem. So they have to have the same problem, around the same problem, and they're going to be grouped together. And for 1 hour, instead of you making $250, you're going to be making, you could be making $250 or above, or 260 or 270 or 280. And what happens here, which people are not getting, you're going to have to drive your price point down, not up. So how do you do that? You then have to see 2 to 3 to 4 people together, because when I can do that, then my price per visit goes down. So like I would say anywhere between $100 to $130 a session per client. Now, are they going to say yes to this? Yes, because it is a cheaper price. It is 50% off of what you guys are currently charging. Like this to me was, when I came up with this literally last week, I was like, oh my gosh, this is it. Like, this is it. If I had to build a practice right now and do it all over again, I actually would only be doing this. I would only do it this way, because I could get my time back and actually charge more. I would make more. The patient would pay less. That's how this works.
And ultimately, that's what we're seeing anyway, is there's lots of price concerns. And then adding into that of something that PelviBiz is really good at, that this is something we're reinforcing, is community. How many of you would love to go to pelvic PT with your bestie? You know, I would not miss an appointment if me and my best friend were getting our problem solved together. It gives them support because everyone thinks their problem is unique, but we know it's not. So
Right.
they're not alone. It's going to increase those results, and you guys are building your community even stronger. So it's adding so many other tiers that really are going to set you apart that you don't even acknowledge. So um, with the group trainings and stuff, Kelly, regarding virtual and in person, can we talk a little bit more about kind of the versatility in that, and that it doesn't always have to be just an in-person group or just a virtual, and
Yep.
that maybe that they could do a good hybrid mix, and kind of what the hybrid would look like?
Yeah. So, number one, I still believe one on one is going to be a thing. Let me just be clear on that. I still believe one on one is going to be what some people want, because traditionally that's how they're trained, whether or not they're patients or whether or not they're providers. However, I do believe if you can wrap your head around it, I do believe there's just a better way. And it's our job then to educate. And so, I believe also too, you shouldn't just have a brick and mortar and just stay brick and mortar. Brick and mortar, I've been saying this for years now, always has to have some online component as well. And vice versa. If you are online, you should always have some in person. So what I mean by that, if I'm strictly just online, like I just like coach people online or I just treat people online, then I need to have retreats or events that are actually in person to create a community. If I am just strictly a brick and mortar, I actually need to have online offerings so that the busy moms that are busy aren't just like, well, can't come and see you today, can't drive there, so I guess we're just out of luck. You are losing. We did a webinar on this. You are losing, we came up with it, $64,000 on average a year if you don't integrate teletherapy. I don't think that that's clear enough. You're losing $64,000 a year if you don't integrate teletherapy. So for those that are like, well, I can afford to just keep doing what I'm doing. Trust me, it's here. Remember, we have access to over 400 pelvic floor practices. I'm not just telling you guys what I think is going to happen. I'm already telling you what I see is happening. So it's not like I don't study this every day. We study it, and it's going this way. And I can't tell you too, to piggyback off this, guys, how many people over the last month have joined our program and they are students. They're PT students and they don't even have a license. And they are like, we just had one PT student. She literally just sold $4,000 to one lady online, all virtual sessions. One person. She made $4,000 in PT school. Would you guys have liked to make $4,000 PT school? I would have thought I'm a millionaire if I did that. I didn't have that option. It wasn't on the table. Now it is. Okay? And people want it because it's convenient and they get their problems solved over the internet. And they could pick now, whoever across state lines, they could pick the best of the best. And by the way, it's not the best of the best of like who's the best therapist. It's the best marketer. This is what most of us also don't understand. You have to be the most amazing marketer, not the best therapist. Okay? Most amazing marketer wins because then people know you. If they don't know you, they can't buy anything from you. You can't treat them or even help you if you don't know how to market. And then you have to know how to sell, meaning not an old car salesman. You have to know how you're actually going to get people to get out of their head and say you cost too much, or I can't afford you, or I don't have time, or whatever. You have to know how to handle that objection. So you have to be really good at those two things. And that's what, as PelviBiz, we teach that stuff, because we know if we can teach you that, y'all can handle all the stuff on the back end with coaching them and teaching them and all that. We have no doubt about that. But we know that the gap is where you guys struggle with the most is getting people to know who the heck you are across the whole freaking US and the world. Why not? I'm saying why not? Times have changed. You know? And
Hmm.
I just think it's going to take a lot of switching of our brains to really understand what I just said, because it honestly, I know I'm just really simplifying this, but it took me 3+ months every single day trying to figure out what is the best way to do this where y'all get more money, the patient has to pay less, and you also get your time back. It hits all three categories, and it's group coaching.
I do want to throw in this as well there, guys, that Kelly has been thinking about this for actively for 3 months, but has been in her brain for a very long time, all while having a clinic who did have 500 plus patients a month, four
Right.
plus therapists on board. So I know there's a lot of you who might not even be at that level, and take that in consideration. If someone who is at that level is making that much money, knows that things are shifting, that they can't make it and sustain that. For everyone who's saying, I'm okay right now, being solo, I'm comfortable, I have just enough, you won't have just enough in the next couple of months. That's what
Yep.
we're really trying to let you know, is that once that train passes, you're going to be struggling to get back onto it, and
Yep.
it's not going to be just enough. This just enough phase in healthcare is only going to last for a little bit longer because AI technology and speed is there. All of you can relate to Amazon, 2-day shipping. We want it now. And
Yep.
so take that into consideration as well, as it's not always going to be good enough.
Right. And people, to go off that, I think that's a brilliant point, Julia. To go off that, people are going to be losing their jobs because of AI, and people are not willing to pivot. And so they're just going to be left behind, which means there's going to be a massive market that then is going to still need therapy. Okay. But it's not at all. You guys think it's bad now. They're not at all going to be able to afford $250 a session or whatever you charge. So how can you make it more affordable for them without making us crazy and us burnt out? The answer, like Julia said, she's right. I have been heavily in it for 3 months, but I've been thinking about this for a very long time. The only answer that I truly believe is group coaching. It hits all the boxes. I've racked my brain over and over and over and over again, and that's it. And so y'all got to know how to do it, and you got to know it's different. It's not what they're teaching you in the Con Ed classes. It's not what they're teaching you in school, because they're teaching you all the best manual techniques in these Con Ed classes. It isn't that. You have to know how to coach, whether or not you're coding therapy or not. You have to coach, which means you got to ask the right questions. You have to actually know how to get people motivated to do the thing that you're asking them to do after the call, right? You have to have accountability. You have to have, like Julia said, community, because ultimately I all think that we're going to be really lonely behind our computer screens, and I believe community will win. Okay? You have to know how to do all of this. And just like Julia said, if you do not get on the train now, other people already are. They're in my program. They're in PelviBiz. I'm telling you right now, I am coaching this actively right now. And because we don't stay the same. Okay. Just because maybe you coached with me 2 years ago, guess what? I'm completely different. I don't have any of that training. Okay. Actively, we are coaching this, and we are seeing massive results. Like I said, the PT student within 2 weeks got one person from joining PelviBiz and literally got 4K just from one person.
She was in our program for real for only 2 weeks. She has 2 more months within this program, and to see that she already made her money back is insane, all online. Even in the last 2 months, we have 3 people in our program who are only online. In the
Yep.
last 3 years, we have not had anyone even touch online or teletherapy. So
Yep.
we know, we're seeing it firsthand, and these are providers, these are doctors who are
Yep.
now not labeling themselves as those anymore so that they can have a bigger reach. And that's ultimately what you guys want too, right? Is to help more people, help moms who may not have the time or money for it. And we know increasing your costs for your one-on-ones is not going to be the solution for them.
Yes. And we are also, we haven't done a big announcement of this, but I will do a soft announcement of this. We are also branching out. We have been in many talks with many NPs that we are helping, MDs we are helping, and we are going broader because we know what we provide can actually help anyone in the medical world that wants to move into coaching and also still use their medical background. And the trends are there. The number one thing that we are seeing from other disciplines besides therapy is maybe they come in person for that one visit, but the rest are all online.
Mm-hmm.
So you guys may not believe it just yet, but the trends are moving in that direction of patients getting more and more comfortable with having treatment online. COVID, I feel like, was the initial push, and it's now just getting therapists on board and getting them to understand and think differently. And I would say we're going to be the people that are going to hold ourselves back the most, because if you don't believe it, because most of us don't believe it because you weren't taught it. So you're just scared. And that's okay. You're just scared. And so, you being scared, that's why we're here to help. That's why we're here to help get you guys to learn how to coach people, whether or not you have a brick and mortar, whether or not you have just online, you have to learn how to coach either way. And if you can just coach and learn the skill of coaching, you also need to learn the skill of marketing. Those two in combination will be your winning ticket, that you will not ever have to worry about AI or whatever is going to take over the market. It won't be that way. You'll be able to continuously be able to grow and know that you're good and your family's good.
Mm-hmm. Yeah, you're no longer restricted by insurance boundaries or state guidelines anymore.
HIPAA,
Um,
everything.
yeah, it's all shifting. And like Kelly said, we provide you with the information on how to utilize your medical background. You guys went to school and spent that time and money for that information, and now we're just going to show you how to better promote those tools to other people to help them understand it. It's just going to elevate everything. It's going to give you everything that you guys have wanted and give you what you deserve for that time. It's just a different approach, and that's it. It's not giving away, your credentials. We're showing you how to better utilize them and show the world that you have more to offer. Like Kelly said too, we do a lot of research. I can tell you very honestly, I've been doing a lot of research on you guys, and a lot of you don't pop up on social media or Facebook or Instagram, and your websites are very hard to contact. So we know that that is something that if I'm having a hard time looking for it and I'm looking for you, I can promise you people who need your help, who aren't going to take that much time, can't find you. And we're here to help you with that. And we're going to make it easy. We could provide the systems for it, the community for it. So you know that you're not alone. Even though we are in pelvic, that shows even more that we know how to grow a niche. We know how to grow and help you portray that messaging to very small groups of people. So just because we're in pelvic doesn't mean that restricts us. It actually empowers us even more to help you because you have a bigger audience.
Yep. Yeah, I love this. And if you guys have any questions, we've actually opened up our phones and you can text us, and I'm going to give you the number. You can literally text me at any time, okay? And ask us any question and we're going to respond. Now, maybe not at 3 o'clock in the morning, okay? But at normal office hours, we'll respond. Our number is 703-783-2388. Let me say it again. You can text us at any time, 703-783-2388. Any questions that you have, you need clarity on something, please just shoot us a text, and we'd be more than happy to respond to you to get that question answered, and get your problem solved. Because we know right now, after doing all this research, that y'all are going to have a lot of questions on this. You have a lot of questions, and we're ready to help. And that's all we want to do. So um, please text us. Yeah.
And if you are ready to take on online even more and you're wanting some more one-on-one background and information on how to do that, we are having a PelviBiz event this October in La Jolla, California. It is October 19th, where we are going to be going over exactly the same things: how to get you to feel confident coaching, how that transition might look like, what hybrid looks like for you, and how you're going to be able to scale it. This is going to be one of the most transformative events that we have because we are seeing that transition. We have gone through the transition and have built multi seven figures online and brick and mortar. So that's coming up. If you guys really are ready to elevate and on this change, definitely come to the event. The link will be in the description, and then you can find out more information on our Instagram as well at PelviBiz. And if you want to learn more about pelvic as well, we are going to do some more information on pelvic. So if you're a different healthcare provider wanting to know about the pelvic floor, this is still open to you as well. It is not restricted for pelvic providers.
Let's freaking go. Like, can I come to the event? I mean, I'm like ready. I mean, guys, this event is going to be the most transformational event you've ever literally attended. When I mean transformational, the people that have attended our events in the past, we've had anywhere between 5 to 10 people walk away from that event and completely quit their job that day and start these businesses and make 10K to 70K months. I can't tell you how transformational it is to be in a room with us and with like-minded people that are just going to make you think bigger, be better, become an amazing human being, whether or not that's in fitness, for your family, business, therapy-wise, whatever it may be. We're going to elevate you, and your mind is just going to be blown. And the best way to do that is when we're all together in the room. And I can't do that as much online, but when we're together, oh my gosh, it is magic. So if you're like thinking, should I go to this event or not? I can't tell you a better event to attend this year is to be at the PelviBiz event October 19th. All right,
Mm-hmm.
October.
Yep.
Yes. So thanks, Julia, because thank you for reminding me, because it just gets me hype knowing that we get to help transform lives at that event. And I'm just get super excited about it. Yeah.
Yeah, it's going to be a great event. It's a tax write-off. If you didn't even know that, that means you should
Right.
come to the event, because those are more information that we are going to be able to provide to you to save you money while you're investing in yourself and growing. We had 4 people leave their jobs at our last event who are now solely in their profession, in their business, making their salary times 2 within 3 months of being in our program. So the event truly is inspiring. It's nothing you're going to see anywhere else. Um, so again, yeah, if you guys have questions, please Instagram DM us. You can text us anytime regarding coaching, the event, anything at all. And yeah, we're excited to talk to you and hopefully see you guys at this event.
All right, guys. Well, thanks so much for listening. And hopefully, you start to implement coaching versus therapy. So hopefully you start implementing that. And please text us if you have any questions. Thanks, guys.